This is my student support system. Keep watching, keep learning.
What is blood grouping? Individuals have different type of antigen on the surface of red blood cells. These antigens, which are inherited, means we receive these uh, antigens or tendency from the parents, and they cannot be changed later on. They determine the individual's blood group. In addition, individuals make antibodies to these antigens, but not of their own type of antigen. These antibodies circulate in the bloodstream, and the ability to make them like the antigen is genetically determined and not associated with acquired immunity. We have many types of blood grouping system, but most common is ABO system and RH system. What is ABO system? In this system, blood is divided based on the presence of antigen, that is agglutinogen, on the RBC. For example, people whose RBC display only antigen A, they have the type A blood group. And the people, those who have only antigen B, they have blood group B. And the individual who have both A and B antigen, their blood group will be AB. And those who have neither A antigen or B antigen, their blood group will be O. Blood plasma usually contain antibody against these antigens, that is known as agglutinin. They react with A or B antigen if they are mixed with each other. These are the anti-A antibody which react with antigen A and anti-B antibody which react with antigen B. The blood group A individuals make anti-B antibody. Okay, they do not make their own antibody against their own, they make against another. So the people who have blood group A, they will make the antibody B which react with antigen B. Blood group of B individual, they make anti-A antibody. Blood group AB make no antibody, and blood group O make both anti-A and anti-B antibodies. You can understand this by this picture. On the RBC, if antigen A is there, then the blood group type will be A, and their plasma will contain anti-B antibody. If their RBC have antigen B, their plasma will have antigen A antibody and the blood group will be type B. If their RBC contain both antigens, their plasma will contain no antibody and this will be type AB. And they are known as universal recipient because they can take blood from all the types. And then if the RBC do not contain or do not have any antigen, but they have the both antibodies in their plasma, and this is known as type O. RH system of blood grouping. The RH blood group is so named because the antigen was discovered in the blood of rhesus monkey. People whose RBC have RH antigen are designated as positive, and those who do not have RH antigen are known as RH negative. And based on this, we say that O positive, O negative, or A positive, A negative, and so on.
My student support system. Keep watching, keep learning.